friends to the Vision. I'm your host, Bonaventure Sissoko, and I'm so happy to be here with you today. You chose a great day to be here with us. Last week, we talked about post-traumatic stress disorder. This week, we are going to continue our discussion of mental disorders by answering some questions about anorexia. We have a lot of special guests here today. We are very fortunate to have you all. We also have the Hakeem Olajuwon family here with us, whose daughter is currently living with anorexia. Thank you all for being here today and taking time out of your busy schedules. Please introduce yourselves to our viewers.
Hello, my name is Dr. Kesey and I'm a clinical psychologist that specializes in eating disorders.
I'm Dr. Ajwa. I'm a psychiatrist.
Hi, my name is Dr. Aya. I'm a doctor who works around the world specifically with patients with psychological disorders.
Hi, my name is Dr. Felicite. I'm a therapist who specializes in working with individuals who are suffering with an eating disorder and their families.
And now to introduce the family.
Hi, my name is Mamadou Hakeem Olajuwon. My daughter has anorexia.
My name is Bintu. My daughter also has anorexia.
Hi, my name is Bobby. I'm 10. My favorite color is purple. There's something wrong with my sister.
So tell us why you're here today.
Well, our daughter has anorexia, and we want to be here to get a deeper understanding of what she's going through. The more information we have, the better we can support her through her recovery.
That's wonderful. Thank you for sharing your time with us. We will help you better understand your daughter's condition with some frequently asked questions. Sometimes they will be specific to one of our special guests, and sometimes they will be open to anyone that feels the urge to speak. So let's get started. First question goes to Dr. Akisi. Can you tell us what anorexia is?
Sure, Bonaventure. Anorexia nervosa is a psychiatric disorder characterized by unrealistic fear of weight gain and distortion of body image, which then results in self-starvation or limit of food intake. Anorexia affects roughly 10 million people in the U.S. alone and has the highest death rates among mental health conditions.
Very interesting. Now before we continue, let's take a message from our sponsors. And we're back to the vision. Now, Dr. Ajwa, could you talk a little bit more about the symptoms of anorexia?
Of course. Inadequate food intake leads to rapid weight loss, which is extremely unhealthy for a person's body. Often they will feel weak, tired, and irritated. There's a distortion of reality for them, which causes some amount of binging, purging, or restricting. Some people with this disorder will also compulsively exercise.
Interesting. So what exactly is happening with the brains of an anorexic person, Dr. Akisi?
As Dr. Ajwa mentioned, their brain is no longer what would be considered as going through normal thinking. There is an extreme distortion of body image and they no longer see food as energy or something enjoyable. It is a daily struggle. In the brain of patients with anorexia, the pathways that carry neurotransmitters are not working properly. Also, when different neurotransmitters such as dopamine and serotonin do make it to a distinct area of the brain, such as the amygdala or insula, they are not properly read. Improper levels of dopamine may explain why anorexics feel intensively driven to lose weight, yet feel little satisfaction in actually losing it. Their brain is not getting the signal to eat.
Very interesting. So what causes this eating disorder to occur?
There are so many factors to take into account. From a biological perspective, it has been proven that anorexia is passed down in your genes. Twin studies have been very helpful for a biological explanation. Originally conducted by Holland in 1988, it was found that more monozygotic, or identical twins, both suffered from anorexia compared to fraternal twins. These results are only correlational and do not determine causes and effects of why this disorder occurs. Genetic variability and low levels of serotonin are also being looked into as a factor that caused someone to have the disorder.
Yet there is also a social aspect to the reason why anorexia can be developed. Attitudes and views on body image and how looks are perceived in a family can be pushed onto young people. The environment in which a young person is in, including school and the attitudes there, can provoke the development of anorexia. Media, especially in Western culture, can influence body image. It is also worth noting that anorexia is a form of control. When people feel like they cannot control other aspects of their lives, they can develop anorexia and unconsciously feel like they are in control of something.
So, what types of medications can we give to our daughter to make her get better?
Something important that needs to be given to your daughter is vitamin D and calcium in order to prevent more bone loss. You can use supplements in order to ensure that she gets an adequate amount. Something else that you can give her is an antidepressant such as citalopram. Another thing that might be helpful to her is another antidepressant called fluoxetine, which specifically targets the area of the brain that makes serotonin. If you don't know, serotonin is a neurotransmitter that has been proven to affect your appetite.
How can I help?
Well, Bobby, the best thing you can do is to help your sister get better is just to support her. And remember, she will most likely have a separate meal plan from you. The most important thing is that she eats, even though it will be different from what you eat. Just give her your love and kindness.
Thank you for all the information. Now we know how to help our daughter better.
Very fascinating conversations today. However, if you or someone you know is struggling with an eating disorder, make sure to seek help from a medical professional or call our toll-free confidential helpline at 1-800-931-2237. That's all for this episode. Thanks for joining us today at The Vision. See you next time.